Good afternoon from London, everybody, and good morning to those of you who are in the Western Hemisphere. We have a truly global audience, and it's a truly global topic that we are going to discuss. My name is Erik Berglof. I'm the director of the Institute of Global Affairs at the LSE, and at the LSE School of Public Policy. We are doing together, IDA and the School of Public Policy, a series of events on the COVID-19 pandemic and its impact on, particularly on the developing and emerging economies. This is a joint event together with the International Monetary Fund and with the International Growth Center here at LSE, and also the Firouzlali Institute of at the LSE. So we are meeting at a time when the epicenter of this pandemic has gone from China via Europe and to the United States, but it's now about to hit in a serious way also the emerging and developing economy. As it does so, it will hit particularly countries with many fragilities, not the least in their healthcare systems, but also more generally. We are likely to see both infection rates and death rates go up dramatically, and the economic impact is also likely to be much worse. In fact, many of these countries, particularly those which are more connected to the global economy, they have already experienced the economic impact. They have seen commodity prices tumble, they have seen fall in tourism revenues, they have seen the massive reduction in remittances, they have seen capital flight. So for them, this has already happened even before the virus really had taken hold. But so this is true actually for all emerging and developing economies, but it's particularly true for those with many fragilities. And the more fragilities they have, the more difficult it will be for them to mount a real serious response to this pandemic. So IDC and LSE hosted a couple of years the Fragility Commission, where David Cameron was chair. And one of the lessons of that commission was that we have to think very differently about economic policy in countries with deep fragilities, and also what we ask for these countries to do in return for support. And I have myself been interested in the role of the international financial institutions like the IMF and what role they can play in these countries. And I think that particularly the IMF can have a very important role or even responsibility in building institutions like central banks and basic institutions for mobilizing revenues for governments. And it was also something that was emphasized in the final report of the G20 Eminent Persons Group on global financial governance. And I had also the pleasure to be part of a review of the IMF's work in fragile states a few years ago. And the findings actually at the time were rather depressing, particularly given the potential. And work in fragile states was not taken very seriously, and working on these countries was not valued very much by the organization when it came to promotion and the like. In response to the review and the EPD report, the IMF has taken on to change its approach fundamentally. And now it's essentially a requirement to have worked on a fragile country when you are promoted to senior positions. And the work has become much more systematic. And the book that we are discussing today is very much part of that effort. And I'm convinced that this change of mind and heart will greatly improve the capacity that we have to support countries with fragilities. We have an absolutely fantastic panel today. I will present them as I give them the floor. But before I do so, I wanted to give my co-chairs, Ralph Chami, Assistant Director of IMF's Institute of Capacity Development, and Jonathan Lee, who is the Director of the International Growth Center, just a few minutes to say what they are doing to address this very serious crisis in the developing world. So maybe I can ask you, Ralph, to go first.
Sure. Good morning, everyone, and thank you, Erik, for the chance to be part of this timely event. In the few minutes that I have, I just thought I would share. Let me see if I can bring up my just to give a sort of a background before my task today in this minute or two is to kind of highlight what the IMF is doing with regards to shoring up the membership and dealing with this crisis. And really, I cannot do justice to the extensive work that the institution is doing, but I'll try my best. Just to, as a background, let's keep in mind that before this, OECD had, in its report, said that 80% of the world's poorest are slated to be living in fragile states by 2030. Currently, fragile states is the home of over 1 billion people. And so far as of April 26, we have 10,000 recognized cases, and I'm sure those cases have increased since then. In terms of what my institution is doing, and this is just a very, very quick summary, the IMF rapid financial support facilities have been increased to 100 billion. The extension to 2030 of the 1 trillion IMF lending capacity is taking place. The G20 have followed the IMF and the World Bank's call to freeze bilateral loan repayments for the low-income countries, which were due in 2020. And there's also a fundraising ongoing to increase the size of the Catastrophe Containment and Relief Trust Fund. These are grants for debt relief and IMF loans. Of course, there's so much is going on, but at the same time, the demand for the IMF, demand from the membership for IMF help is only increasing for about 100 countries that have requested help. But we've been before, during, and after, we will continue to provide extensive policy and technical advice. If you, for the audience, please, you can access the IMF website. There's tremendous information there. There are also publications that are coming out, that have come out already on Fiscal Monitor, just to name a few, the World Economic Outlook dedicated to the COVID, the GFSR, the regional outlooks, and of course the special series on COVID-19. And I can't help but make a plug for our book, which is forthcoming with Raphael, who's presenting today, and Peter Montiel at Williams. And let me stop here. Thank you.
Thank you very much, Ralph. Jonathan, can you make a few remarks?
Well, thanks, Erik, and thanks very much for inviting me to join. As I think many of you, perhaps not all of you know, the International Growth Center is based at the LSE, but in partnership with Oxford, and supports developing country governments, combining an international network of researchers with resident country teams across Africa and South Asia. We're currently focused on supporting our governments in their COVID responses. And we're seeking to do that by helping to provide new data, particularly on the economic impact of the crisis, research insights and new research, while also seeking to contribute to evolving global thinking on the crisis. We're particularly pleased to co-host this because fragile states have been an important part of the IGC's work since its inception. We, as Erik mentioned, hosted the LSE Oxford Commission on State Fragility, Growth and Development, which Tim Besley and Adnan Khan helped to lead. And in fact, they're also now leading a follow-on initiative of ours called Reducing State Fragilities. And this new initiative is really aiming to bring new evidence and new thinking into global debates on state fragility, while also working with national governments in countries which are transitioning out of fragility. So it's a great pleasure to be here and part of this event.
Well, thank you very much, Jonathan. And we're now going to move into the panel. If I can ask those of you on this call to mute your phones or mute your Zoom, and also turn off your videos when you're not speaking. So can I then ask Tim Besley, professor at the LSE, who was of course very instrumental leading this commission that Jonathan just referred to, and has extensively worked, of course, on state capacity and lack thereof in many parts of the world. So, Tim, the floor is yours.
Thank you very much, Erik, and thanks to everyone for joining us. I'm just going to say a few short things in the 7 minutes I have to give you a bit of a bird's eye view and to link back the topic of today, which is specifically around the response to the COVID crisis, with the themes that we touched on in the Fragility Commission, which has been referred to both by Erik and by Jonathan. Sorry, I'm just trying to get this to get down. There we go. I don't need to really tell you so much. Erik set the scene very well. I don't think anyone is under any illusions that the challenges we're currently faced are going to be over anytime soon, and are likely to have a lasting impact on policy, on the way we ask states to develop capacities to, particularly in the area of public health, but much more generally than that. And what I'll come to at the end is also the nature of global cooperation, and I'd be very interested when we come to hear more from our IMF colleagues on how this is evolving. Again, I think it goes without saying that the starting point for facing the crisis for fragile states is an altogether more challenging one than many other states face. And even though we've been focusing on the challenges in recent years of fragile states, there is still a huge amount that needs to be done, and many of the failings that have been highlighted for such states will likely be features of what happens in the coming months. I think the thing we need to remember is there will be a humanitarian priority here, but we have to think of this also being in the interests of the developed world to meet these challenges, not just on humanitarian grounds, but on the grounds that by building a more effective set of states around the world, we can operate more and more effectively as a global community in response to many of the challenges that we face. And I'll emphasize that a little more in a couple of minutes. So what I'm going to just refresh your memory for any of you who've seen it, and for the first time, I'm just introduce you to a few of the ideas that were developed in our report, Escaping the Fragility Trap, because I think it nicely sets the scene for much of the discussion we're having today. There we discussed 6 principal symptoms that we felt were part of the syndrome of state fragility. Very often a security threat from organized non-state violence. Second, that we're dealing with governments that lack legitimacy in the eyes of their citizens, which inhibits their capacity to act. States with themselves very weak capacity to deliver on essential functions, whether it's raising tax revenue, building public health systems, or enforcing contracts and doing things that support the private sector. That means a weak environment for private investment with significant knock-on effects to the economy. An economy which is typically exposed to shocks with little resilience. And of course, the COVID shock is hitting the world, but the nature of resilience will really be tested in every country and will be, I think, a particular challenge in fragile states. And often, as we noted, these are states where there are deep divisions in society, which are part of the underlying reason why there is state fragility. So we highlighted all 6 of these in our report, and I think all are still relevant today and are important to bear in mind when we're thinking about how such states can respond. We identified a range of issues with what we regarded at the time as current approaches, the approaches that in particular, global community has been taking towards fragile states. A lot of these are, when you look at them again, I mean, 2 years on since we were writing the report, they look very they look very familiar still, and also relevant to the COVID crisis. A lot of policy thinking driven by quick reactions to emergency situations. Of course, that's what we're going to see a lot of over the next 6 months. Fixation on the idea that fragility has a single root cause, and if only you could find it, you could fix it, which we argue is really, as I've already illustrated through these 6 items that go into a syndrome, is really not a very helpful way to think. And also inferring strategies for the escape from fragility from the current characteristics of Western democracies. And a particular example at the minute is not so much a strategy for escape, but the speed with which many countries have tried to introduce lockdowns, which have become a feature of Western countries, without thinking about the applicability of those kinds of policy responses, I think is a case in point in the current crisis. We highlighted some recommendations, institutional priorities being building checks and balances, building state capacity, a greater focus on the private sector, and encouraging, and this is something I'm really going to talk about today, distinctive solutions, not trying to think in terms of we apply a sort of common template that can be successful in every place. So briefly on the particular challenges of COVID-19, there's little doubt that in the near term, it's going to be humanitarian issues that are going to take priority. The context for doing that, though, is probably less promising than in the past, partly because developed countries are distracted by their own policy needs due to the nature of the global crisis. And a number of us are concerned, and Erik spoke about this, about the extent to which that distraction is going to take away from international efforts to deal with the developing world in general and fragile states in particular. There's no sign yet, although there may be some green shoots that some of us can tell us about, that developed country governments are willing to step up the level of international assistance. And most, as we know, already do not honor the 0.7% commitment to aid finance. And the thought that that might happen in the current climate seems quite remote. The concern for me is that this will mean the return to the usual cycle of palliatives without long-term progress. It may be that the international community can be helpful in the humanitarian efforts, but the movements beyond those efforts have proved extremely unpromising in the past. Let me give you an example. The Democratic Republic of Congo got UN peacekeepers around 15 years ago, thought to be a temporary measure so that it could give way to a domestic security solution. But those peacekeepers are still there 15 years later. Many of the things we do as trying to deal with short-term problems unfortunately become entrenched, and we do not get that transition from dealing with the very awkward situation in emergencies to making a transition path towards development. And we really need to remind ourselves of that and try and do better this time. The macroeconomic outlook for poor countries is extremely grim, but we should be very cautious at staring at forecasts. The record of forecasting following unusual events is particularly bad. And what we really should be looking to is not so much forecasts as appropriate narratives to guide the policy response, of which data is important, but looking at some projected time path for the economy is unlikely to be a helpful way of looking at things. There's a need to take a holistic view, not just macro aggregates, but it's absolutely essential that we look at the distributional implications of all the actions that are taken. Because one thing we're learning throughout the world is this is not a common shock within countries. People are suffering in very different ways, and nobody should act on the back of macro aggregates without remembering what's going on underneath those. And just a word to our IMF colleagues that they may wish to respond to, that now more than ever, the way IMF does its monitoring through things like Article 4 assessments really needs to be changed and modified to be appropriate to the current circumstances. Let me just illustrate something which worries me a little bit. This is not because I don't think this was done with good intentions. This is a chart from a presentation that Alfred Zoifak, the chief economist for Africa in the World Bank, gave last week to show you what their models are predicting about the severity of the downturn in Africa. And as you can see, mostly the severe crisis and the catastrophic crises look like about 5 and 8% of GDP. Well, look at what the OECD countries are predicting, admittedly not on a quite comparable basis, because these are quarterly, not annual numbers. And so it may be that they're predicting quite a strong bounce back, so that the numbers may not be so uncomparable. But minus 25% for the US, minus 23 for Canada, France, Germany. I'm worried that we're not really at a point where we're facing the reality of the kinds of shocks at the macroeconomic level that these countries are going to face. There may be reasons to be to expect these rather mild turns, but I think we've got to be prepared for something much worse. And I think finally the OECD has got itself some sense of realization of the magnitude of the challenge that we face, even though I still think the narrative of a V-shaped recovery is extremely problematic. Finally, I'll just say a word about institutions. We've got to think of ways that are realistic in the context of the institutional frameworks that are in place. We've got to be careful of using solutions that might be suitable for the developed world and trying to map them too readily onto the solutions that might be viable in fragile states, where even things around record keeping for infections and deaths are much less good. Lockdowns have much larger economic costs, especially if you can't have a viable social safety net. And contract tracing and selective isolation, which I think will become what we'll need to do in the developed world, will not in all reality work in the developing world in general, and certainly not in fragile states. What will we get? I think the great risk is we'll get a prolonged involuntary isolation of parts of the developing world from the rest of the world, with very severe economic repercussions, because the choice of many countries will simply be, we cannot afford to continue to engage with these countries, given that they potentially can reinfect through travel, at least, other parts of the world. Is there any ground for optimism? I always try and end a presentation on this with some more optimistic slide. Well, could this be the moment in which the world finally moves in a more cohesive direction? Of course, there's a salutary lesson if you look at World War I versus World War II. After World War II, the world pretty much fell apart. International cooperation failed. Indeed, lack of international cooperation probably contributed to things like the propagation of the Great Depression. After World War II, the international community tried to come together, somewhat imperfectly, but they tried to come together to try and build institutions, including the IMF, the World Bank, the UN, and others, to try and improve global governance. So is this the moment where we can have the next conversation about the overhaul of global institutions and their governance? We do live in a difficult world where there's no consensus on values and institutions, which will prove to be extremely difficult in doing that. But public health is an area where I think there's huge scope for greater global cooperation. There's a lot of discussion at the moment going on around creating a global vaccine, and building state capacity for delivery of healthcare and sanitation is certainly a case in point.
Thank you very much, Tim. And I had reasons to look a bit more closely at the forecasts and doing some calculations around what was forecasted for North Africa and in the Middle East, and the kind of downturns that we will see in those countries are orders of magnitude larger than what you showed in terms of the World Bank. So I think you're absolutely right that I think you haven't really taken in what's going to happen in those countries. Thank you very much. So the next speaker is Raphael Espinoza. He is now the Deputy Division Chief of the Fiscal Affairs Department and also an external research associate in the University of Oxford. He's been a previous academic at UCL. He has worked at ECB, so you bring a lot of experience to this topic as well. Please, Raphael, the floor is yours.
Thank you very much, Erik and Jonathan and the LSE team for organizing this very timely event. Let me share my PowerPoint. This is, first of all, my own views. The view expressed in this presentation are mine solely and do not represent the views of the IMF and its executive board. Just standard disclaimer. And it's also work that has been done together with Ralph and my chair, Peter Montiel. It's part of the work that we've done for the edited book that Bart mentioned at the beginning. So let me explain what I'm going to do. I'm first going to say and explain how fragile states are different from other developing countries, and explain what challenges state fragility pose to policymakers. I will then explain how this affects the macroeconomic policy response to the COVID-19 shock that currently countries are experiencing. So let's start with a familiar image, which is the poverty. The 2 points of my agenda that I was mentioning. What is different in fragile states and how does that affect the policy response? So we start by noting that fragile states are, like other developing countries, often stuck in poverty traps, and we know about that. These link low incomes to low capacity to grow. And there are many reasons why this may be the case. Low income, for instance, leads to less capacity to save and less investment, which then feeds back into low growth. Tim also mentioned limited resilience, which is very problematic for many countries. The second trap that fragile states are stuck on is a fragility trap. And of course, there's a lot of literature on that. And I'm mentioning a couple of references at the bottom of the PowerPoint. And the key of the fragility trap is to understand that state capacity is not exogenous. It's endogenous to the relationship between the society and the state. There are several factors possible for that. One is that the private sector is poor, which means less tax revenues for the state. And then if the state doesn't have capacity, it has less capacity to tax. There are similarly important point is the idea of accountability that is developed by the fact that when the state is able to deliver some services, and we'll talk about health services, I'm sure, during the panel, then people realize the value of the state and are more engaged with the state, more willing to pay their tax, etc. Now, one important element is to understand how the poverty traps and the fragility traps interact. It's interesting to show them near each other because we can think about the links. So let me start with arrow number 1. Arrow number 1 shows how state fragility reinforces the poverty trap because, as an example, many companies in fragile states lose some of their sales to theft or vandalism. They also have to have their own electricity generators to high private security. So a lot of the public goods that are expected, that are important for overcoming a poverty trap are not there in fragile states. Arrow number 2 shows how the poverty trap can worsen the fragility trap. So it's kind of intuitive that poverty would increase the likelihood of conflict. There are other less intuitive elements, but that are well documented in literature. For instance, countries that are poor are also more dependent on a few primary commodity exports, and this creates rents that can become a source of conflict. Arrow number 3 also notes that functional states are often needed to get out of poverty traps. For instance, building resilience to natural disasters, that's a public good, but public investment is low when the state doesn't have tax capacity, doesn't have tax revenues, and therefore doesn't have financial means to invest. So as you can imagine, facing two interlocking traps is very challenging because the dynamics of one trap can be the initial conditions of the other trap. So on top of that, the COVID shock now is hitting right in these different elements of the traps. It risks, therefore, setting fragile states back in their fight against poverty. This is the issue of resilience, of commodity prices that have fallen to the ground in the last couple of weeks. There is also the question of the effective delivery of health. It's going to be essential for legitimacy of the state. And so the risks are, of course, very dramatic. So what can be done? What should be the policy response? So the general principle that came strongly from, for instance, the IMF fiscal monitor that was published a couple of weeks ago, is that countries should do whatever it takes to support the health response, to provide fiscal support to firms and to households. At the same time, countries should also keep the receipts. And by that we mean that because fiscal transparency, public accountability, institutional legitimacy are essential, they have to be taken care of. And this is especially important in the two situations that we're talking about today, which is there are going to be large policy response that have to be undertaken. And for fragile states, these issues of accountability and legitimacy are fundamental. On top of that, for low-income countries, there is the issue of financing space. So fiscal space is really constrained. Not only that, it got worse. So the left-hand chart shows the difference between 2019 on the vertical axis and 2012 on the horizontal axis for different fragile states. So the debt service as a proportion of the tax capacity has increased. Low-income countries also often have some external buffers in the form of aid or in the form of remittances. But for instance, these right-hand side charts come from the World Bank report and suggest that remittances could fall by 20% this year, as migrant workers in advanced economies are also losing income. And Ralph could talk about that later on in the Q&A as well. So less fiscal buffers, less external buffers. For fragile states, policies also need to understand how the shocks and the policies are affecting cohesion and the costs and benefits of mobilizing violence, because fragile states are at a high risk of conflict, but conflict is a decision by some of the agents in the society. So we have to understand what are the costs and benefits of mobilizing violence, and we have to understand how these are moving along time. So monitoring, as Tim was mentioning, monitoring of distributional effects, it's essential. Now there are some positives there, is that policies to prevent conflicts have a higher rate of return. So I think the World Bank report from a couple of years ago estimated that each dollar of investment in prevention saved on average $16 in terms of human and economic losses being avoided. Finally, strong international support on the ground can be successful. We saw the experience in 2014, 2016 when there was an Ebola outbreak in West Africa. There was a strong involvement of the UN, of the WHO, of NGOs such as Doctors Without Borders that can really make a difference. Let's think a bit about tax and spending policies. So the objectives should be twofold. First, identifying, of course, the effective policies. That means those that can reach the right people and the more vulnerable people at the cheapest, at the lowest cost. At the same time, a second priority is also to have the biggest legitimacy bang for the buck, again, because of the special issue that is affecting fragile states on legitimacy. There will be country-specific constraints. We talked about fiscal space, and there is also the question of the adequacy and the coverage and targeting of the social safety net. So when fiscal space is available, policy options should include one-off transfers, which have the advantage to be very inclusive and therefore play a role in social cohesion. In-kind provision of goods and services are also going to be probably very often used. Wage subsidies and tax deferrals are possible for the formal economy. For countries without fiscal space, the priorities will be to strengthen the existing social safety nets. They don't have to be formal safety nets. They can be more informal systems. Providing sector or place-based transfers will also be one of the way, and especially for the direct provision of basic needs. On the customs and revenue side, governments will want to set exemptions and preferential tax rates for health products and ensure swift clearance at customs. At the same time, protecting revenues will be essential, and that could call for increasing some taxes and tax collection, for instance, with solidarity surcharges. For oil importers, because of prices have really fallen to the ground, further taxes could be increased as long as they're not perceived by consumers and by the society to be an additional burden. Identifying and monitoring largest taxpayers would be a way to preserve some of the revenues. So let me conclude by saying that facing this crisis will require extraordinary and concerted effort from the international community. At the same time, we should keep in mind that state fragility brings another layer of challenge and complication to international aid, and political economic considerations have to come center to any engagement.
So thank you very much, Raphael. I think you made some very important points, and we'll come back to them, I'm sure, in the discussion. The next speaker is Adnan Khan, professor at the School of Public Policy here at LSE. He used to work also at the International Growth Center as the research and policy director. He has also been at Harvard for some time, and he, unlike most of us, has a very real experience of how it is to work inside government bureaucracy in countries with fragilities. So, Adnan, the floor is yours.
Thank you, Erik. Thanks for the invitation. I don't have a presentation. I'll just say three things. The first being more of an observation, and the other two hopefully being substantive points. The first thing that is striking to notice is the huge degree of disconnect between the magnitude of the crisis and the urgency, scale, and type of policy response, both domestically and globally. At the domestic level, especially in low-income countries, we are seeing a lot of corner solutions, outright denial to everything is under control, to a policy response based on complete shutdown, often switching between these options without much evidence. At the global level, there is an impressive response, at least in terms of economic policy, fund and bank and other bilateral and multilateral donors. But given the scale of the crisis, I must say the response seems timid at best. Given estimates that the scale of the interventions needed by many countries, their economies, perhaps range between something like 3 to 10% of their GDP. That's a massive number. And the lack of urgency and the scale of response at the international level is striking, I would say. Something for international institutions to ponder maybe. Given, this is all the more striking given the situation where we are, where in many OECD countries, the responsiveness at the domestic level is often speedy, quite effective, but also huge, massive, and where it seems like all of the rules of fiscal prudence and other things have been broken. The lack of a similar response when it comes to working with low-income countries and fragile states appears even more striking. Okay, so let me make 2 points. One about, so both have the same flavor about new thinking required to respond most effectively to the crisis created by COVID-19 in the short run in fragile states. Because otherwise there is a danger that the short-run crisis may lead to long-run economic stagnation and to conflict in fragile states, and we may face more failed states, fragile states, and increases in state fragility. And the world as a whole may have to live with the consequences of this for a long time to come. So along these lines, I have two set of comments. So one is more about like what domestic countries could do along a few specific things, which is on protecting the economy and the vulnerable and the poor in fragile states and low-income countries. So the first set of comments is about social protection. Given that this massive shock has hit the poor massively and is something that can lead to like poverty traps and a lot of more people falling into poverty trap. And my colleague Oriana will talk more in more detail about it. Let me just mention one thing, which is about what kind of response the states could have. So I work with Benazir Income Support Program in Pakistan, and in some countries, like West in Pakistan has had quite an impressive response in more than doubling the number of beneficiaries that it is providing support to. So about 12 million beneficiaries, about 1/3 of them, those who are already within the cutoff of BIS support. Others that they can use their existing data to extend the cutoff and extend the aid to. And a remaining roughly 1/3 which are identified using new methodologies. And again, there are concerns about whether the data is good enough. There are transition into an out of poverty. Urban areas are hit more massively. So does this capture them? Do the news methods are subject to abuse? All of those concerns being valid, but still the speed and the degree of response was quite good. This is also true for India, other places which already have machinery in place to identify and to target the poor and to extend those measures. But the reason I'm mentioning this new thinking is this could also be done in other places, especially in fragile states, where such mechanisms or machinery is not in place. Using new novel forms of data and other data analytics and other things that can be quickly brought to bear on in terms of providing support to the poor. For instance, using cell phone data alone, ideally coupled CDR data, ideally coupled with data analytics and backend checks, one can easily identify those who have been hit hardest by the shock, and to a first degree of approximation can identify and can target support to them. This is exactly what our colleague Mushfiq Mubarak is doing with the government of Bangladesh there. Again, something that can easily be done in other fragile states and developing countries. Yes, there will be inclusion and exclusion errors, but at times like these, I think one needs to worry more about the exclusion errors rather than the other. The other is about firms protecting employment and firms in fragile states and developing countries. And that's because the economic recovery in the medium run will depend on the labor market policies put in place right now. There are two massive shocks. So there's a huge reduction in labor demand in some sectors, while simultaneously other sectors are facing labor shortages. How do you identify who is affected? How do you protect them through wage employment or firm protection policies? Is challenging for developing countries where most of the labor is in the informal sector and where one cannot use the standard like reporting and other mechanisms that the developed countries have. And again, new thinking, innovative thinking is required in order to address that. Last comment, which is again something I would say the most important. Having worked in and with governments all my life, I think new thinking is mostly required in terms of the domestic policy response of how do you deal with this shock and not just the mitigating consequences of this afterwards, but how do we deal with it right now? And again, Jonathan and Tim were mentioning the Fragile State Commission. And one of the key findings of our report was that copying solutions from outside doesn't work for fragile states. Possibly doesn't work anywhere, but especially doesn't work and backfires in the fragile states in undermining their capacity even further and in throwing them further into state fragility. And this is all the more true for the current policy response to COVID-19 in fragile states and low-income countries, where the default response in many places has been to follow what other countries are doing, follow the herd. And if there is anything that is farther from truth is following that policy, partly because most of the OECD countries perhaps have also not covered themselves in glory in dealing with the COVID-19 response, but also because the underlying conditions are hugely different in low-income countries, given demographics, given the age profile, given the underlying disease distribution also, which is quite different, and given the state of the existing capacity in those states, and given the trade-off between the whatever advantages that you will get through certain policy measures like lockdown versus not just the economic consequences, but even the health consequences of people, for instance, like I could give you examples like of pregnant mothers not going to hospitals for delivery and other non-COVID related increase in morbidity and mortality in those states, which is of orders of magnitude much different than in developed countries. So the choices that the developed countries have taken are not the ones for developing countries to follow. So working with a group of colleagues, what we are suggesting to them is smart containment policies with active learning. And let me spend the last minute to just explain what I mean. The active learning part is basically act now based on the information that we have, following the standard principles of decision making under uncertainty, but also take action that speed up the learning that is needed, and then refine actions on the basis of the learning that has been actively gained, and applying this to the world of like and not going for corner solutions, but having a graded containment policy, which is not just at the national level, where different areas face different levels of containment based on data, based on also on the capacity of the state, and also with the data responsive in the sense that you also learn about the impact of your policy responses and refine your strategy accordingly. This also has, let me also mention that at least some of the measures taken, at least in some places, violate the agency of the poor and the citizens. The response to COVID-19 cannot work unless we respect the communities, the citizens, and respect their agency also. So in other words, like community messaging with a view to enable voluntary compliance along with compassionate enforcement is a way to go. So we are actively working with several governments in enacting these policies in developing countries. Happy to work with others. IGC is taking these messages to Africa. For those who are interested, they can you can Google smart containment with active learning and can take a look at our work and hopefully comment. Let me stop here.
Thank you very much, Adnan. And you bring together many important aspects of both from working inside and from thinking about it from the outside. Again, we'll come back to this. The final panelist is Oriana Bandiera, who's a professor in our economics department. She's also the director of STICKER, the international center here at the LSE. She's also the co-director of the development program at the CPR. Oriana, the floor is yours.
Thank you. I'm gonna try and share this. Okay, so I'm gonna do basically two things, which is, well, in both cases showing you data, because I cannot talk without numbers. And the first is a data set that's been newly collected about last week by two organizations in Bangladesh. One is the BRAC Development Institute, with whom we work regularly. And another one is an institute that works mostly in urban slums. And so this is Rahman, is the director of the second institute, and Imran Mateen from BRAC. What they did was to do a detailed survey of 5,000 households from a sample of nationally representative households, both in rural and urban areas in Bangladesh. So it's half rural and half urban. These are not just poor households. Half of them are below the poverty line. 15% of them are hovering between the low and the medium poverty line, and 35% of them are outside the poverty line. Now, although there's many non-poor in the sample, the vast majority of primary earners are in casual labor. So they do not have a regular contract. Now, this makes them very vulnerable to any economic crisis. And indeed, more than half lost their jobs. So the percentage of main earners that have been rendered economically inactive by the crisis, the COVID crisis, it's over half in the rural areas, is almost 3/4 in the slums. And this is true for every point of the income distribution that was surveyed here. So of course, if you're very obsessed with causality, you might say this is not causal, nobody randomized COVID. But changes of this magnitude are very hard to reconcile with anything else but the crisis that COVID has created. Now, this means, and these numbers are really staggering, that many people who were well above the poverty line, up to 40% above the poverty line, are now well below it. So the people below are now incredibly below, but people who were far above the poverty line are now below it. This is a very staggering piece of information, because it tells you how fragile the progress that we've made. We've been congratulating ourselves for the past 10 years on how much poverty has been reduced. But we can see how this progress is really fragile. A massive crisis can bring everybody back in. And the most worrisome piece of information here is that many of these households, of course, are short of food now because they don't have income, but they're still coping. But most of them are coping with personal savings. Government support, which is one of the options here, where households were asked, how are you coping now that you have no jobs? Government support is almost non-existent. And the reason why this is not a sustainable thing is that households do have savings, but when asked how long can you go on without having an income, that is, how long can you live off your existing savings, at most, the answer was 2 weeks. So within 2 weeks, these 5,000 households, none of these 5,000 households will have any money to buy food. Okay? Which brings me to the second part of the presentation, which tries to ask the question, where is the state? Where is social assistance in a country like Bangladesh? And here I'm going to show you some evidence based on a recent policy brief, which I wrote with Nikhil Parekh of the IGC, where we analyzed the World Bank Aspire database. The Aspire database, for those of you who don't know it, puts together nationally representative income and expenditure surveys to basically provide information on the coverage and the targeting of all social protection programs. So this includes everything, such as conditional and unconditional cash transfers, social pensions, food and in-kind transfers, school feeding program, public works, and fee waivers as well. So the first thing that you notice, even with this extremely lax definition of social protection, is that the poorer the country, the lower the coverage. If you look at the low-income countries, where most of Sub-Saharan Africa and South Asia are, 82% of people have no coverage at all. 15% have some social assistance, and other programs are non-existent. This, of course, is in sharp contrast with high-income countries, where all these programs are much more widespread. But perhaps more worryingly, the people, that 20% that gets covered by social protection in these countries, are not the poorest. The middle, what this represents is the incidence by quintile of income. So from the bottom, you start with the poorest 20%, the second poorest, the third poorest, and so on. So if you look at Sub-Saharan Africa, which is the column in the middle, you see that the distribution of these transfers is basically income neutral, which, once you take into account how they're funded, effectively these transfers are regressive. So what do we face here? We face really a twin challenge of many people at risk of falling into poverty and completely inadequate protection systems. As Adnan was mentioning already, it's completely delusional to think that we have the capacity and the infrastructure to prevent people crashing into poverty with the existing social protection system. So we cannot, not only because of the coverage, but especially the targeting. The current systems do not reach the poor. So we can't expect that one day to the next they will. Okay? There is an enormous preoccupation in the literature and in the policy implementation about mistargeting, about people who do not deserve the transfers getting the transfers. But I think at this point we should refocus our attention on the second type of error, which is excluding people who need it. Because in this case, this is a situation in which, without exaggeration, in which exclusion errors can kill. Right? So I think the only thing that can be done is universal transfers done quickly. In countries where there is a mobile money system, this can be done by reverse mobile money. So instead of people using mobile money to pay, receiving mobile money by the government, or using existing public networks, for instance, health posts, which are in every community. I would like to finish this slide, this presentation with some optimism like Tim. I find it particularly difficult, but I can finish with a choice. So this is famines from the 1860s. The number of people who've been dying of famine here per 100,000 people. And you see that famines have basically disappeared. And I really hope that it stays like that. But this is ultimately a choice. Where will we be in 2020? We'll be up to here, there, or there. That's our choice. And we have to act, I think, quite quickly.
Thank you so much, Oriana. And a call to action and deep concerns. We're going to now open up the discussion to the audience. We do it in 3 different ways. You can post some questions over the chat room. You can raise your hand in the Zoom function, or you on Facebook, you can send us through Facebook questions. But I already have a couple of questions, so I will start with those. There's Sena Siev Boateng. Are you on the call?
Thank you very much for your presentation. I think it was very good. And yes, you did mention that we had some impressive interventions during the Ebola crisis, especially in the West African sub-region. I mean, the EU Médecins Sans Frontières, the UN and all the bilateral interventions were good. I mean, they came as speedily as we requested. However, most of them were temporary. And then even for me in the desk coordinating the Ebola crisis in Africa at that time, the UN set up its distribution base from Accra, which was a good structure. And then they set up some infrastructure in the countries that were affected. But then soon after, everything was pulled down. I don't know if they didn't want to be reminded of the Ebola, or the infrastructure would let people still have a reminiscence, the struggles that they went through. A lot of the structures that we saw that could have been used now for isolation centers were all pulled down. So I'm wondering how we can, in some of the rural areas, keep these structures. If even they are not used, anything can happen, we can go back to them. These are my thoughts. And of course, to Tim Besley, I do agree with you. These short-term interventions that turn out to run longer than the long term. I've seen a lot of that too in our areas, and that must also be eschewed. Thank you to the other panelists. Erik, I'm done.
Okay. Thank you very much. I think this is such an important question. So I'm going to let the panel come in on this, and maybe Raphael was posed directly to you, but I presume that maybe Tim and maybe someone else will want to come in as well. Raphael.
Let me start then. I mean, this is a very important point, and it reminds us that the Sustainable Development Goals do have resilience as part of the objectives. And so I think the international community has understood the importance of building resilience, which means investing in advance of the kind of disasters that we are facing. And that's true for epidemics, that's true for climate change, that's true for food security. In practice, in the case of West Africa that you mentioned, I don't have the details on the country, and I'm not the right person to answer, geographically. What I had noticed though is that looking a bit at World Bank projects that are currently being done, one of them was scaling up World Bank projects across the region that was really about developing testing capacity, developing quarantining systems, etc. So this kind of thinking had been done in the case of our partner organization of keeping some structure at least, or setting up the systems post-Ebola in the region. Of course, the scale of the challenge here, because it's such a high-spreading virus, makes this even more difficult. But I mean, I fully understand where the comment comes from, and again, I would just refer that to the SDGs. That is something that we have to keep thinking about, and they were part of the agenda. I don't know if Tim wanted to come on that, or.
Let me agree with the premise of the question, that the difficulty is to get some of these humanitarian and emergency investments to turn into long-term transformational investments in running health systems. And I think there's a combination of two things. One is the attention span of the international community. Once an emergency is deemed to have passed, then either there's an emergency elsewhere on which there's some focus, or there's a general feeling that the job has been done, and rarely has it been done, particularly in fragile states. The second, though, is around domestic politics. And I think the world over will face this. After some period of time, it could be 1 to 2 years at the rate we're going now, we will be out of the current crisis. The question is, will there be a debate in any country or in all countries about how we should transform the way we prepare ourselves, we transform our health systems to deal with this? Or will we quickly just not want to remind ourselves of what we've been through and hope that we can return back to a world where, it wasn't the case we totally had our heads in the sand on pandemics, but I don't think in anybody's political economy it was central to anything we were doing. And one has to wonder what the way to do that is. One is to put more reliance on independent institutions that are not subject to the kind of attention span of the political process. Can we have this done in a less politicized way? But there's a real debate to be had about how we achieve adequacy and sustained attention in relation to what we're going to do in future. And I think the premise of the question is, this has been a problem in the past. Will we have learned anything? That's a big question.
Anyone else want to come in on this issue? There's been an interesting discussion going on in the chat room on the use of mobile data and maybe mobile technology more generally. Since we're looking for some positive things to build on, maybe could one or two of you come in to give some examples and maybe also try to make it specific to COVID if you can. Does anyone want to come in? Adnan?
Yeah, happy to come in. What I was mentioning earlier was, there are some countries that have mechanisms in place for identifying the poor, but there the challenge is many of those beneficiaries were identified much earlier, and given the recent shock, it's not very clear as to whether the poor identified through proxy mean stress, basically looking into asset measures of or asset distribution measures of poverty, whether they can adequately capture those who are affected by the recent COVID-19 shock, and should we at least augment them using other means. While in other countries that don't have similar systems in place, there's even a greater need to use cell phone and other data to identify the poor. And one of the ways that we also try to do in Pakistan, and that's exactly what they're doing in Bangladesh, is using cell phone data both the CDR, but also the data on top-ups and other things to identify both the level of consumption, predict the level of consumption and how that has fallen after COVID-19, but also look into the specific ways in which it has based on family characteristics, and then using some checks at the background with the data, consolidating those at the household level. In countries that have everything linked through either cell phone or identity data, one could use other checks at the background to be able to do that. And in Pakistan, what we are suggesting was using telco data on the different revenue bands and the different top-ups by the different companies. And colleague Ghazala Mansouri and others so tested this with other kinds of data on HIS and other data, and it turns out that those are quite accurate predictors of those who have fallen into the poverty trap, and both historically in the poverty trap, but also currently in the COVID-19 shock. And what we're doing is augmenting this with phone data and other types of data. But Oriana may have more to add on this.
Oriana, you want to?
No, I was thinking more of mobile money rather than targeting, but rather to use mobile money as a way to reach people quickly. Because the logistics of reaching many of these people in rural areas, which are typically not very easy to reach, especially in sub-Saharan Africa, the logistics are very challenging. So mobile money gives, I think, a very good solution to reach people very quickly. The targeting is not going to be perfect. I think, I mean, in my mind, the situation is so severe that we shouldn't even attempt to target because it's fairly difficult to do. And so far, as far as we can see in the social protection data, these countries have failed to target the poorest.
And when so the World Bank says, for example, it has something like more than 80 countries where they have effective cash transfer programs. You think they are mostly not achieving what they're trying to achieve?
World Bank data that I showed you.
Yeah, I know. Yeah.
So no.
Erik, if I may make a point here. This is Ralph. Yeah, I think there's an elephant in the room here, which is mobile technology is very important for remitters. As we know, remittances, people still trying to send remittances face very high costs of remitting. And there's a lot of work done by our colleagues at the World Bank on this. And the mobile technology is one way that you can provide competition to the MoneyGram and the Western Union by allowing people to get money to their loved ones back home much faster. Now, this takes quite a bit of urgency in this environment. What Raphael was showing you earlier was a chart that comes from the World Bank, and it's now being picked up by all media, is that the projection for 2020 is that remittances are going to drop by $100 billion. $100 billion. And so if we were, and by the way, part of the SDGs, I think it's SDG number 10, talks about the global effort to lower the cost of remitting to an average of 3%, which is right now is really, really high. Now, what's happening is a much bigger story here. As you know, as the rich countries get hit, the migrant workers in them are getting hit, and they get hit first. So they lose their employment. When they lose their employment, the remittances going home are taking a big hit. Now, the question is, what do these remittances mean to fragile states and low-income countries? They mean the world, because those countries do not necessarily receive private capital flows nor portfolio flows. Their lifeline are these income flows from their loved ones in the rich countries. Now, you can imagine the situation where now you've got these remittances that are dwindling because people in the rich countries are losing their jobs. And those monies that go home provide consumption, alleviate poverty, provide buffer against consumption shocks. They even provide the tax base for the governments that we're talking about, they're supposed to be engaged in alleviating the pandemic shock to their citizens. For example, in many of these low-income and fragile states, they rely on value-added tax, consumption-based tax, trade tax to generate revenue, because they know that most of remittances are used for consumption. So now what you're going to find out is, aside from everything that we're talking about, is this channel of remittances that's going to now be hit hard across the globe. Households that receive those remittances are going to find that their incomes are going to drop precipitously. And in the charts that Oriana was showing, I would say that that effect is going to be magnified if it's not already picked up by the charts that she's showing due to the loss of remittance income for many of these households. And that is going to be devastating in the low income and fragile states. The households lose the ability to purchase education, healthcare, because that's what they use them for, or to purchase any kinds of, whether it's traded or non-traded goods. And the governments that are receiving tax revenue cannot engage in counter-cyclical fiscal policy of any sort because they're losing that source of revenue also. Even the government's ability to finance itself from the banks that are getting those remittance flows are actually going to be hit. So you can see, and by the way, that's going to even have monetary implications for those countries because their exchange rates are already getting hit. They're going to be hit even harder when they lose their remittance revenue. And this time around, those countries cannot export themselves out of this crisis because there's no one out there to buy. And if your currency depreciates, you ain't going to find anybody coming to visit you because the people don't have the money to come and visit you. So, and if you really want to make the story really sad before we try to find a solution to it, those migrant workers that lose their jobs in the rich countries, sometimes they lose their ability to stay in those countries. So what are you going to find is that those migrant workers may have to go home. Now, as you know, the housing conditions, we've seen this now on TV and being picked up here and there, their housing conditions is pretty dismal, okay, in the rich countries. Some of them are housed 20, 30 to a room. So the percentage of them that have contracted the virus is quite high. And if they were to go home already to a country that's basically barely struggling, as Adnan and Oriana were saying, barely struggling to deal with the pandemic, can you imagine if their migrant workers are coming home now, how they're going to deal with this additional pressure? All of that pressuring the system, creating more social pressures and more unemployment. So this, what I'd like to say here is that this effect could boomerang out, spill over from the low-income fragile states back to the rich countries. So when we talk about mobile technology, I mean, let's just put things in perspective, that we're all in this together. All of us are in this together. We need to keep the migrant workers in the rich countries, because then as we protect our own citizens in the US and everywhere else, we need to protect the most vulnerable among us, which are the migrant workers, And by doing that, that stabilizes the remittances home, including trying to lower the cost for them to send money back home so that they stay in the host countries. And thereby all of us benefit from the labor that they provide to us here. And the low income and fragile states also benefit from the lifeline, which are the remittances. I'll stop here.
Thank you very much, Ralph, for that. I have a question from Fred Amonia. Please, Fred.
Erik, thank you. Now let's look at the opportunities. Yes, there's a deep human tragedy in this crisis, but we must not forget their unique, very rare opportunities. So that's a very complex duality. And we can talk about the crisis, yes, we must, but nobody is talking hard about the opportunities. It's very rare to find Africa pulled together. You know this. But this crisis has brought everybody, typically everybody together, and we cannot afford to waste the crisis. So Tim Besley was talking about division in society. This is the time to attempt mending those divisions. Take the mess on the roads of Africa. This is the time to do things differently. So if we waste this crisis, it's going to be really difficult to find another opportunity. So what does the panel think about it?
Yes, I mean, so maybe just to follow up that comment or question, the African Union has just appointed some special envoys and some very serious people to represent it. Do you think, is there a role for the African Union to help in addressing the COVID crisis at the level of Africa as a continent? Anyone who wants to comment on this? I think Fred was talking more about maybe within countries, but also, I guess, at the level of the African Union.
Yeah, I can start off and then maybe others can come in. So I think Fred is absolutely right. Tragic though the crisis is, this is also provides an opportunity for national leaders to unite the nations around a common purpose. Historically, those common purposes have been external wars or something else, but this also provides a huge opportunity. Unfortunately, that's not what we are seeing in many countries, where there's a lot of scapegoating going on. So scapegoating not only of the victims, stigmatizing those who are infected, but also stigmatizing certain sections of the society, either minority groups or others who are seen as disease vectors. So that happens even in developed countries, where we see like either Asians or some other sections of the population being targeted as being disease vectors. In some countries, it is the Muslims who have brought it. In other countries, it's certain sections of the Muslim Shiites or others who have brought it. That's a narrative in Pakistan and elsewhere. So in Africa, it is either the Chinese or someone else who has brought in. That kind of narrative obviously stigmatizes the victims and certain sections of society, also doesn't lead to this sense of a common purpose for building a common society, common purpose society, and undermines that sense of cohesion that is far more challenging for fragile states, which already have very low stock of that, where a shock like this can potentially help on the upward side through creating a virtuous cycle of building trust in the state and building social cohesion, and hopefully also generating increase in the state capacity and legitimacy of the state. But on a negative cycle could also further undermine the state. Where we go, and again, it's the choice is fundamentally of both national leaders, but also community leaders and others, and ultimately to every citizen of the state. To some extent, external actors, not international actors, I would say, like maybe African Union and others can also play a role by supporting, maybe calling out where they see these type of divisive things going on, but also supporting governments and building a narrative around cohesiveness and common purpose. Tim may have more to say on this.
But Adnan, I totally agree with what you say. Let me just add one thing, though, that the way I think about sort of history, this is incredibly crude, and is that, why did war have the effect of making permanent transformations of the state? Well, it was largely because the war necessitated some kinds of fiscal capacity. States did things in a hurry to get resources. And then there's a question, what do you do when the war finishes? And the states that were relatively successful in coming out of periods of war were those that were able to build cohesive institutions to make that path, to continue with a path of effective development of the state and the economy. So I kind of have a condition. I agree conditionally with Fred's question. Namely, surely there is an opportunity for this to build cohesion, but unless that's accompanied by something that makes that cohesion sustainable, so there's got to be an opportunity then to make sure it's built and hardwired into the society, because otherwise the risk is once the emergency has passed, the cohesion is worth very little, because you can't run a society on cohesion unless you have the state capacity and the institutions to make that cohesion turn into good policy on a sustained basis.
Anyone else want to come in? Let me take a few questions from the Facebook viewers. Unfortunately, they cannot come in person. So I have a question from Tuluwalalola Kasali. I hope I give justice to the name. So this is for Tim. 41.3 million people are living in internal displacement across fragile states. Many of them have been displaced for over 5 years and depend on humanitarian aid to meet their basic needs. The COVID-19 pandemic amplifies the cycle of poverty and inequality for this vulnerable group. Can you speak to the importance of ensuring that governments include the health and social and financial needs of internally displaced persons in their COVID-19 national response plans? And looking forward, how do states ensure that IDPs, internally displaced persons, are supported to achieve self-reliance to rebuild their lives and move them toward a durable solution? So that, Tim, if you can think about that. And then Kailas Taware, poverty is a problem in developing countries, but migrant workers are in crisis with hunger. Some are dying on the way by walking several kilometers. Government response is very poor. Shall they die on the way? So I guess it is just focusing on migrant labor, and how. And the follow-up question is, how can world agencies respond to this situation? And maybe, yeah, I think we can. Well, that's a specific question for Adnan as well, and this is quite an important question. Do you think the debt cancellation by the IMF for certain developing countries would rather incentivize the governments to be more prone to corruption, especially in countries where the corruption is highly prevalent? Or do you think it can be used in the other direction? So this is, of course, not just about IMF, it's about the general issue of debt cancellation that's being discussed now, also of bilateral and private creditors. Tim, can you start on?
Yeah, I mean, I can only agree with whoever asked the question, that this is a hugely pressing problem. It's not an area in which I have any particular professional expertise in knowing how one deals with the specific challenges, but sort of passing this up to the sort of the stuff that you talked about, Erik, and in your opening remarks about how without the kinds of cooperation that are needed globally, we simply are unable to create the solution. So I'm a little bit, forgive me, inclined to come back to you on the question, since you're probably better placed to answer it than me. But it's got to be by strengthening global cooperation. I know you've been very closely involved yourself in trying to build more globally cooperative solutions.
Yeah, I think I don't know, Oriana, you have been. I wanted to give you a chance to comment on this question.
Anything particular to add? But given that you gave me the floor, I wanted to comment on the corruption question. I think there is an enormous concern against corruption, and somehow the belief that the optimal level of corruption is zero. And there are lots of policies, very expensive policies adopted to make sure that the level of corruption goes to zero, which never happens. And many of these policies end up costing more than the benefit that they bring, because inevitably to reduce corruption, you have to put somebody in charge, and that somebody can be even more corrupt. So when we exit the crisis, it would be good to rethink corruption in a way of understanding the causes and working on the causes rather than the symptoms. for the moment, I think, as Adnan said before, the exclusion errors are way more serious than any misappropriation of resources that the debt cancellation could lead to. So I think that to save lives, we might be worth risking somebody making some extra money. In the grand scale of things, if you believe that we should reduce corruption at all costs, that cost these days will be really, really high.
And the question was posed to you. Do you want to say something more?
I completely agree with Oriana. I think this obsession with corruption has often led to solutions which are in the spirit of the cure being worse than the disease. And we need to revisit that question. Having completely agreed, on the specific context of fragile states, we discussed it in our commission as well. There is this issue of, call it, debt cancellation potentially creating perverse incentives, and not just around corruption, but also along other margins. And our discussions in the commission were also that one has to think carefully about those perverse incentives and the incentive structures, and a blanket debt cancellation may not help. Whether the current crisis is a different moment, and certain countries perhaps require different policies, and what kind of incentive structures should be put in place, I leave it to others to comment on.
Raphael, do you have anything to say on? It's of course very much relevant. The question was about the IMF and what can the IMF do to ensure. And I think the message here is that maybe this is not the time to have strict conditionality. We should try to get money out into these economies and try to reach more people. What is the thinking in the IMF?
Let me clarify, this is going to be my own thinking and not the thinking of the IMF. But I would say that first, I take the issue very, very seriously of corruption. And this is an area where I think for fragile states, we have to be careful as well, because the legitimacy of government is essential. And the feeling that the government is being abused to protect a segment of the population or some segment of the elite is, I think, a very, very important thing to keep in mind, because at the end, the cost of conflict are also huge. Right now, we're talking about the pandemics, but the long-term costs of fragility are huge. I was mentioning earlier in my presentation that the rate of return of prevention measures are very high, and that's not because prevention measures are super efficient, it's because the cost of conflict are huge. And so the idea that social inclusion, that the government is used for the benefits of everybody is really important, and more so in fragile states than maybe in other developing economies. In terms of IMF loans, I think the IMF has a long experience of that question. For decades now, we've had a system to deal with transparency and good accountability of the money that we use. These include safeguard assessments of central banks. When money is watched to central banks, there is an extensive assessment of the central bank systems to ensure the right accounting, the right transparency of the use of the funds, the right governance of the central bank. This extends to treasuries when treasuries receive the money as well. We can also have systems in developing countries that receive some of our funds right now to ask in a condition that the money be well used. We have systems for in some countries we ask for the beneficial ownership of firms that are awarded contracts that are linked to IMF programs. This information should be made public, etc. So there is a lot of work on transparency of the use of public funds under IMF programs.
Okay, I think we are reaching our time limit here, and I just wanted to thank everybody for these very important comments. And we speak about fragility, and the point was made several times that these countries with fragilities are not just sort of less rich countries. These are countries that have very specific institutional arrangements, and that's also, we need to think about that when we think about how to respond to the COVID epidemic. And also what Oriana has been stressing several times is these are what we have achieved in terms of poverty reduction, of very fragile achievements, and we should try to err on the in the direction of including too many rather than including too few, and the cost of excluding is very high at the moment. And so there was this question of what does the international system do, and I think this is probably the most extreme test we've had of the international system since it was sort of founded in the aftermath of the Second World War. And I think it's being tested as we speak, but it's also going to be tested going forward. And what is absolutely critical is this ability of the system to respond as a system and make sure that there are not these gaps between organizations. And I think, for example, the example was given of internally displaced persons or migrants, and they often tend to fall between institutions. So it's very important in each of these areas, whether it's about pandemic or addressing migration, to get this kind of collaboration and have very clear leadership for organizations. In the area of migration, it is UNHCR and IMO that are the leaders, and then the rest of the institutions should follow that and try to support, and maybe these institutions are not always the institutions best designed to implement specific programs and so on, but then the development banks should be responsible for that. But there need to be political leadership, and that's what's being tested now. We are seeing that these institutions are trying in many ways to respond to the crisis, but their shareholders, and particularly maybe the G20 shareholders who have the majority of most of these institutions, they are behind the curve and are not responding probably in the way that we would have liked. It has improved, and the last meeting of a week ago of the finance ministers produced an action plan, and I think now it's very important that this action plan is followed up by actual implementation, and also that we prepare these institutions for the next phase of what's coming in terms of the need for resources for these institutions. Luckily, some of them have been relatively recently recapitalized, and we should make use of that. But I think it's fair to say that all these institutions will be tested beyond their current limits, and we need to find new ways of providing them with capital, and also, of course, importantly, try to solve the debt problems that are rising. And it was alluded to in one of the questions that we are facing a major challenge now to get a broad agreement on forgiveness and or at least in the beginning, maybe just a moratorium, but ultimately get thorough debt relief and get it from everybody, not just from the bilateral creditors, also particularly from the private sector. And that's going to be a difficult but necessary process. So with those final remarks, thank you very much to the panel. Thank you to our co-organizers, the IMF, the IDC, and the Fiddle Valley Africa Center. So thank you very much. And we have a lot of work in front of us. So thank you.